Hello, I'm Cassandra, and I will enlighten you on the significance of making evidence-based decisions in Villa Health for cystic fibrosis patients. Most of the CF-based treatment measures are focused on short-term remedies on diagnosis, which is a shortcoming for individuals residing in remote areas who greatly succumb to severe complications due to pulmonary exacerbations. According to SchoolLink and Korn, hospital leadership has not made maximum achievement to standardize the management measures of pulmonary exacerbation amongst patients suffering from cystic fibrosis, and that's leading to increased mortality and morbidity being reported on a daily basis. Therefore, lack of access to the appropriate care for CF, such as physicians, medical equipment, and medications, dramatically contribute to the decline of patient outcomes due to mismanaged exacerbations. SchoolLink and Kwan, 2018. Thus, in this video, we will look into the evidence-based measures that can be helpful in Villa Health to address CF, especially for individuals residing in remote areas, while utilizing Caitlin's case provided in the assessment instructions. Let me share some information with you about Caitlin. Caitlin has been admitted for the second time in the last 6 months in the pediatric wing of Villa Health due to pneumonia. She is 2 years old, and on arrival, she received emergency care to stabilize her condition since she was experiencing shortness of breath. From the analysis, Caitlin weighs 20.7 pounds, has secretion from chest physiotherapy conducted, and her sweat is concentrated with excess chloride. Dr. Copeland has assessed the reports, and she ascertains that Caitlin has CF and immediately recommends the necessary treatment, like an IV with piperacillin and pancreatic enzymes. She also said that her temperature will be recorded continuously at intervals as indicated in the developed treatment nursing plan. Caitlin resided in McHenry with her mother since they separated from her dad, Doug, an hour away from the hospital where she is admitted. The parents work for extremely long hours, and thus making long trips for consultation will be pretty tricky for them, which in turn will negatively affect the health outcomes of Caitlin since CF is sensitive. Therefore, Caitlin's health becomes a great concern to the Villa Health medical team and Dr. Copeland. Fortunately, in Villa Health, Dr. Benjamin, a pediatrician doctor familiar with CF, does practice there. Hence, Villa Health pediatric nurse sets up a meeting with him and Dr. Copeland to discuss Caitlin's treatment needs. Though the recommended treatment was not available on their hospital telemedicine platform, he was willing to work at Villa Health. They will be utilizing text messages and Skype if there is concern about Caitlin's health. They also consulted the social worker of that region to check the status of the parents' insurance cover in covering her medical expenses and any other social help that will positively impact the outcomes, such as peer groups. Lastly, since the mother had access to smart devices before the child was discharged, she was trained on caring for CF, such as chest therapy and temperature monitoring. She was also offered all the necessary equipment, such as respiratory, temperature, weight monitors, and all the contacts she can utilize when a need arises. In addition, she received training about using technology such as Skype to consult the hospital in case of Caitlin experiencing any strange symptoms or for follow-up purposes. The data collected on the monitor provided will be helpful during the health reviews of the patient. Now, I will explain how an evidence-based practice model was used to help develop the care plan for Caitlin. According to Copton 2020, telemedicine was greatly helpful in preventing CF patients in Villa Health and succumbing to infections and severe complications with the coronavirus outbreak. Patients were offered a new opportunity to make consultation through the technologies such as medical apps, other than showing up physically on their respective specialized clinics. Since technologies and the available healthcare workforce helped the adults living with CF, it was easy to adopt such measures for Caitlin. The study indicated the effectiveness and efficiency of telehealth technology in treatment. This activity was possible because it enhanced communication and adherence to CF treatment through consistent video consultations, follow-up routines, text messaging, reminders. Villa Health caregivers should use CF management tools while assessing Caitlin. This technology will help to monitor constant respiratory and temperature bills and make Skype engagement with the pediatrician and chest therapists and respiratory evaluations. At least 4 times respiratory reviews per day are crucial to monitor the impacts of the prescribed treatment options. It is imperative to remember that the temperature and respiratory instabilities could negatively impact Caitlin's health outcomes. The Skype engagements with the nurse and chest therapist will be essential to ensure that any strange symptoms are appropriately handled through education and peer support. The respiratory monitors offers the pediatricians evidence about the chest actions of Caitlin. The incident monitors will deliver information on the prompts of temperature and respiratory variation, which will help the healthcare team cooperate and construct a care plan to ensure that her health gets better. The devices and medications delivered will help to avert any other emergency complications and enhance Caitlin's health outcomes. Next, I will reflect on which evidence was most relevant and valuable when making decisions regarding the care plan. The decision to utilize a telemedicine approach and cooperation with other healthcare professionals for Caitlin emanated from the urgency of her CF diagnosis. Although the acute condition forced Caitlin to travel a long distance to search specialized care at Villa Health, Caitlin's parents also had busy schedules involving long working hours and could not meet their daughter's health needs. There still lack enough medical resources or equipment to effectively manage her condition, thus proving the essence of relying on telemedicine intervention. The study by Compton 2020 offers adequate evidence to support the telemedicine solution of reducing health access challenges for patients in remote areas and also helpful for lowering hospital congestion, which in turn will increase the delivery of amenities and increase patient satisfaction. Copton 2020. Lastly, I would like to identify benefits and strategies to mitigate the challenges of interdisciplinary collaboration to plan care within the context of a remote team. Caitlin's mother is quite worried about her condition. thus raising concerns about the chest physiotherapy she's receiving, since she noticed some red marks on her chest region and wanted to know whether she missed out on any step. The interdisciplinary partnership guaranteed that Caitlin obtained constant assessment and care from the appropriate healthcare workers at the luxury of their homes. Villa Health staff should also use a healthcare system such as telehealth, which all the healthcare staff is familiar with, to accurately monitor the patient's symptoms and consistent communication amongst each other through Skype, telephone, and text messages. Therefore, the overall consequences of the cooperation of the distant interdisciplinary team will lead to enhanced patient outcomes. To sum up, to improve access to care and physicians, integrating evidence-based measures into the current health technologies will enhance the excellence of care and safety for individual patients regardless of their environmental location. Moreover, the evidence-based model will help the nurse advocates formulate individualized care plan for patients joined with the current health technologies to offer the best affordable care. Finally, the ability to organize the interdisciplinary groups and implement the present research contributes to increased patient health outcomes. Thank you.